Once the practitioner has done a little bit of open questions and reflections and listening and staying with the person a while, then one would want to begin to formulate a goal collaboratively with the client and or a target behavior that we're going to address more specifically. Okay, so the formulation of the goal might include something that is sometimes labeled guiding, whereby the practitioner now invokes information or some guidance along the way about, about where one would go at this point. So if the goal were to be discussing the improvement of medication, that would also be done collaboratively, so that the practitioner and the client would agree together that that might be what we'll talk about today. So there's been some improvement, not all the way, and one might just ask, is this something you'd like to, work on today, to come to some agreement about a goal, rather than the physician deciding, well, we have to address this today now. It didn't improve well enough, which would lead us to another strategy in motivational interviewing, which is affirming, rather than saying, oh, you didn't do it the 4 times a day, how are we going to change that? You know you have to. It's going to be a lot of problems for you down the road. One would say, so you've actually have improved over what you've done before, which would be an affirming response. Affirming really has to do with affirming people's strengths, their resilience, and finding many ways. I could understand how tough it must be for you to live with this condition all the time, and the effort you're trying to put into keeping it under control and how it interferes with other things in your life. And so these are affirming kinds of responses that give people credit for what they're doing and build on their strengths, rather than look at, oh, you're not doing it the 4 times, we've got to get you on board here, or something to that effect, which could be very well-meaning, but it really shapes the client out and begins to perhaps cause what is referred to as resistance in motivational interviewing. It used to be referred to as resistance, actually, which has now caused discord. Because when a person is in a situation with a professional who is continually telling and shapes out their participation, then the client can become aloof or non-participatory. And then the work together is not on track at all. It can become really disparate or dissonant, where the client is saying, this guy doesn't even listen to me. I've been coming in here, I'm telling him this, I can't do it because of that, he's not listening, so I'm not even going to bother to say it. I'll just let him talk. And which is really the furthest away that you would get from behavior change if you find yourself in that place. And if one finds himself in that place, it's the practitioner's responsibility to join up where that client is and to get back on track. And this really has to do with employing strategies and intervention that match up with the client's readiness to change. So one would perhaps give very different responses to a person who comes in saying, I'm not doing any of this. I know everybody wants me to do it, but I'm not doing it. So I need to respond very differently to someone who says, well, I've been thinking about it. My leg does hurt. And if that could help, I might do it. That's a person who's a little bit more ready than the first one versus the person who says, I really have to change this. I can't live like this anymore. It's terrible for me, my family. They have all kinds of reasons that are important to them to change it, and that would be a very different response. So if I'm in a different place than the client's readiness, I begin to engender discord. The client saying, I'm not doing any of this, and I have the plan ready. Well, let me tell you what you have to do here. You have to take this medication, do it 6 times a day. You're going to end up looking like this, in that kind of shape, etc. And I've disregarded that this client has not moved along in the readiness to change. So in addition to engaging the approach of open questions and following, etc., really help the person go a little bit further. And the strategies in motivational interviewing would be to help the client identify some of the negative aspects of the behavior. The person might say, I'm fine with this. Everybody else has a problem with it. I don't care if I die when I'm 45. Everybody else cares. I don't. I'd rather drink my beer, whatever I have to do and live shorter. That's my preference. So in a situation like that, one would need to try to evoke the other side of the client's understanding of this, and like with something like might be called pros and cons. All right, so it seems that drinking beer is something you really enjoy. It's a part of your social life. It helps you relax. You can't imagine your life without it. But on the other hand, other people in your life are bothering you about it enough that you've actually come here to talk to me. So that we want to start listening from that other side. Tell me more about that. Is there anything at all that concerns you about your drinking? So that the practitioner now begins to bring the client into a place where he or she could recognize the positives and the negatives. And usually that puts the client in a place that's called ambivalence. Now they're really not sure what to do. On the one hand, they really like it. On the other hand, now they can see there are 3, 4, or 5 real problems here, and they can't move. And then the work becomes to assist the client to facilitate the resolution of ambivalence through facilitating an exploration on the client's side of what this is really all about for them, and bringing them to perhaps, here's where motivational interviewing becomes directive, because the practitioner would use strategies that would pay more attention to the reasons to change and not so much attention to the reasons not to change. This is called change talk. They would reinforce what the client is saying regarding reasons to change in many different ways by reflecting it, adding it in a summary, asking for expansion about, what do they mean, what is it like when people bother them, asking them to expand upon their statements. And that becomes the strategic directive part of the approach.